Hello, my name is Dale Gardner. I'm the National Clinical Lead for Organ Donation, and this is a talk on Deemed Consent England, what clinical staff need to know, and was recorded in March 2020. Can I introduce to you Dr. Paul Frost? He's an intensive care consultant based in Cardiff. When opt-out was introduced in Wales in 2015, he had a number of concerns and reservations. Luckily, these worries did not come to fruition, but he shared his personal journey during the opening plenary session at the Intensive Care Society State-of-the-Art meeting in December 2015. And this 4-minute video I'm about to show is part of a recording of an interview Paul did with Anne Harrod-Griffith, a professional development service specialist nurse, after his talk that day. Let's have a look.
So my name's Paul Frost. I'm a consultant in intensive care medicine and I work in a big teaching hospital called the University Hospital of Wales in Cardiff. Around 1,600 admissions a year, and it's a new intensive care for Wales. So unsurprisingly, we are deeply engaged with the process of organ donation. And typically in Cardiff we would have somewhere between 20 and 25 consented donors most years. Now, working with Deemed Consent has been quite a journey for me, because back in 2015 I had some reservations about this legislation. And before I talk to those, I preface that by saying I've always been very supportive of organ donation. I think morally, ethically, it's absolutely the right thing to do, and it definitely needs to be routinely considered as part of good end-of-life care. My concerns about deemed consent were well rehearsed, and they're certainly not unique to me. They've been expressed by lots of people, but I think they are worth reiterating. So I was concerned that presumed consent was being used synonymously with consent, and I don't think that's a reasonable thing to do. Consent, by its very nature, requires informed discussion, explanation and understanding, and of course permission by the patient. And that individual choice and that personal autonomy is a very important principle in the practice of medicine. And I was concerned that presumed consent was being used as a synonym for consent, and it certainly can't be used in that way. I was also worried about soft opt-out. I was concerned that soft opt-out might not provide the safeguard that these patients often need, particularly for patients who don't really have any interested family or friends. I was worried too that the legislation would open the door to a very aggressive requesting approach, and I feel somewhat embarrassed talking to a senior snod like yourself, Anne Harrod, about this, but I was worried that metaphorically, instead of just knocking on the door of these sort of end-of-life discussions that we have, you'd be kicking the door in, and I now know that's obviously not the case. And I was also concerned too that the sense of gift that families experience, often months and years down the line after these bereavements, that you can get some solace, some comfort for the fact that when you're at your most emotionally bereft, you still had the generosity of spirit to allow the retrieval of organs from somebody that you love dearly. And I thought that sense of gift would be eroded by coercion, or by the sense it was now being forced because of deemed consent. But most of all, I was just worried. I was worried that paradoxically the legislation would undermine the process and undermine public trust. I find this bit of the conversation on Harrod difficult, because of course what I have to say to you is that I was wrong on almost all of those causes, or all of those concerns. So the legislation came into play in 2015. We're now 2019, so we've worked with this legislation now for 4 years. And over that time, I've realised that none of my fears have come to fruition. And in fact, soft opt-out is a fantastic safeguard. The SNODs take extraordinary care to try and properly establish what the wishes of the dying person would have been.
And the full interview is available on YouTube, and it's approximately 7 minutes long. Since we actively sought as an intensive care and emergency medicine community to increase the number of donors, and we did this by starting to implement the recommendations of the UK Organisation Task Force in 2008, we have seen dramatic success. We have doubled the number of deceased organ donors. Now, a key recommendation was getting the right people interested at a local level in organ donation. Some call this the triumvirate of Organ Donation Committee Chair, Specialist Nurse for Organ Donation, and Clinical Lead for Organ Donation. This recommendation and its implementation has proven to be the most powerful and successful of all the recommendations, because it always comes down to people. The initial UK success came from increasing referrals, which led to more families approached, and more families approached led to more donors. And what you can see from this graph is that the family approach increased from approximately 1,500 per year to a steady state of around 3,300 family approaches a year, achieved around 2013. One of the milestones achieved by the increase in donor numbers passed us by in 2012 essentially unnoticed. Since 2012, a transplant has been the number one form of renal replacement therapy for chronic kidney disease in the UK, overtaking all other forms of dialysis such as hemodialysis and peritoneal dialysis. This not only saves lives, it transforms the lives of those who received a transplant. And not only this, it saves the NHS money, as a transplant is cheaper than dialysis, even accounting for the costs of the transplant and immunosuppression. So during this time of increasing numbers of families approached, the consent rate did not change. This is probably no surprise. Traditionally, families were often only approached if it seemed they were likely to say yes to donation. The work we did between 2008 and 2013 made it the practice that all families would be approached, even if there was a medical possibility for donation. And as you saw, we doubled the number of family approaches without dropping consent. Our current success, however, is coming from increasing consent. Our current strategy called for a revolution in consent, and that's what we've been working on. Perhaps not as fast as we would hope, but it is occurring. Our success has come from our marketing and media campaigns, and the work of the organ donation committees promoting donation in their local community, the specialist nurse and specialist requester training with the emphasis on consent, and the collaborative approach when discussing donation with families, the doctor, bedside nurse, together with the specialist nurse or specialist requester, approaching the family to talk about donation together. Future success is hoped to come from opt-out legislation change. It's already in Wales and coming to England and Scotland in 2020. In Wales, the deemed consent law was passed in 2013, and after a 2-year implementation period, commenced in 2015. Scotland passed their legislation in July 2019, with a planned implementation of autumn 2020. Have a look at the vote in the Scottish Parliament. Only 5 parliamentarians spoke against it or abstained. That represents enormous cross-party and public support. This should give us great confidence. 3 of the UK Crown dependencies have also brought in deemed consent. The top flag represents Guernsey, the middle Isle of Man, and the bottom Jersey. And Her Majesty the Queen passed England's deemed consent legislation in March 2019. Take note, this was a private member's bill, a Labour Party private member's bill, which the Conservatives supported. Cross-party support like this is rare in Parliament. Also, it was a private member's bill. If one parliamentarian in either the Commons or the House of Lords had spoken against the bill, it would have died. This should give us enormous confidence that when we approach families and explore donation with them, we go with the full backing of Parliament and society. We should feel confident we are doing exactly what is expected by society. Probably what most of you want to know is, what changes? Well, these are the 4 steps for exploring consent for organ donation in England from March 2020. Step 1 remains completely unchanged. Refer, break bad news, and approach the family with a specialist nurse or specialist requester. We call for 100% referral, and that's what's expected. As we observed in Wales, families expect donation to be discussed, and they are not surprised when we do. Our colleagues in Wales tell us that often families will bring up donation first, or when it is raised, they say, "We were expecting that. We have talked about this," and the answer is. Additionally, from public consultation, there has emerged a societal expectation that donation will be discussed at the end of life, even if just to explain why donation cannot go ahead, or that we are aware they have opted out. The last bit is very important. Some members of society have expressed concern that the ability to opt out is a fake or a gimmick, that we won't really check the register and we'll just take organs. Every time we go into a room and say, "We have checked the register and we have seen that such and such has opted out," and that's what we will be following, provides huge reassurance to these communities that opting out is real, that we do check, and people's donation decision is respected. In Guidelines for the Provision of Intensive Care Services, GPICS 2, it states what best practice for approaching the families for organ donation involves. The consultant leads on breaking bad news before handing over to the specialist nurse for organ donation when it is clear that the family have accepted the inevitability of their loss and are ready to consider what may happen next. In Step 2, the specialist nurse or specialist requester will establish if an express decision regarding donation has been made by the patient. A prior express decision does not just have to be written, it can be verbal, as in a conversation with a family, and it's equally valid. A written express decision is covered by checking the organ donor register. Now, to discover a verbal decision, the specialist nurse will have to discuss with the family, and this is not always as easy as it sounds. It is the last known decision which is the one that carries legal weight. If that does not apply, if there is no prior express decision, then deemed consent might apply. But deemed consent will not apply if a donation decision has already been made, as we've been seen in the previous slides, to those under the age of 18, for people who have lived in England for less than 12 months or are not living here voluntarily, for those who lack the capacity to understand the new arrangements and take necessary action, for novel transplants, and if there is no family or friend of long standing to consult. This last one's important, and please take note that an independent mental capacity advocate, an IMCA, cannot consent for donation. It's also important to remember that this is a soft opt-out, that families must be consulted and families' objections will be respected. In Wales, you can see this occurring. The deemed consent rate is not 100%. Family objection is respected. Now, our specialist nurses for organ donation, specialist requesters, have received additional training to lead these conversations so that they can follow the law, follow the associated and quite detailed Human Tissue Authority codes of practice, and approach and support families. Now, if deemed consent doesn't apply, then we are back to exactly what we've been doing for years, and the legal consent comes from the family. So step 4 is anyone else, and exactly as we've been doing it for many years. But just as Paul Frost said at the beginning of this talk, some clinicians, like Paul, have worries and concerns. One of these is, will it even work? Is all this effort and money worth it? Well, let's just have a look at what happened in Wales. The consent rate in Wales in 2014-15 was 49%, the worst in the UK. By 2018-19, it was 77%, the best in the UK. We have carried out a statistical analysis comparing Wales to England. In donation after brainstem death, but not donation after circulatory death, we saw there reached statistical significance in Wales, a 10% difference in the consent rate at the 0.05 significance level. Now, a risk-adjusted logistic regression analysis revealed that there was a 2.1 times higher chance of gaining consent in Wales compared to England at the end of the study period. And this data has been accepted for publication in an Anaesthesia special edition on organ donation, time for deemed consent, coming out in May 2020. Similarly, donation numbers in Wales in 2014-15 weren't looking too bad, second best in the UK. But by 2018-19, way out in front. So why did it work? Well, we're probably going to be arguing about this for years, but I have two theories. The first theory is greater public awareness. As we said earlier, in Wales, families expect donation to be discussed, and they're not surprised when we do. And the families often go, yeah, we're expecting that, and we've talked about it, and the answer is. And so there is much greater public awareness of organ donation in Wales. But also greater clinical confidence. This one's a bit subtler. With so much public and political support for donation, there appears to be greater confidence in Wales. Not just in the specialist nurse and specialist requester, but in the doctor and the bedside nurse, such that going into a family and exploring donation is the natural and right thing to do. It's just expected, and with that comes greater confidence, especially when more and more families keep saying yes. Alternatively, some fear it will work too well and intensive care won't have enough beds. Let's leave COVID-19 aside for the moment. Firstly, it won't change immediately. In Wales, it took 2 years to have an effect. The best estimation, and hope we have, is that we will see 100 extra donors per year, and we won't reach those levels for 2 to 3 years. So what does 100 extra donors look like if spread around all the different sizes of donating hospitals? For a level 1 hospital, you might see an extra 1.5 donors per year. For a level 2, maybe just over an extra donor every 2 years. For a level 3, maybe just under an extra donor every 2 years. And for a level 4, an extra donor every 5 years. Remember, these patients are already on your intensive care unit. You have already made the decision to approach the family and discuss donation. All that has changed is now there is just a greater chance of the family saying yes. Some people have a philosophical concern. Will enough people know they need to opt out? So the marketing budget is around 11.7 million spread over 2 years. In marketing terms, they talk about reach, how many people could have been exposed to the marketing, and this is running greater than 90%, which is excellent. Importantly, they speak about awareness. Have people seen or heard something about the law change? The goal was 60% by the law implementation, and this goal has been hit already with a few months to spare. And our marketing research has shown that 54% of people have had a discussion regarding donation, and many have gone on to record their decision. Over this recent time, we've seen opt-out continuing to rise. But when we look at Wales and we look at opt-out, we can see that 6% of the population opted out. We are suspecting a similar percent will opt out in England, perhaps a bit more. One concern some people have, which we heard Paul talk about, is that deemed consent changes or devalues the gift of organ donation. In Wales, we have absolutely no evidence of this. Joanna Duckworth was one of the first deemed consent families in Wales, and this is her speaking in the opening plenary at the Intensive Care Society State of the Art meeting in December 2019, just after Paul Frost. I am so happy that Scott was able to donate, as it brings me so much comfort that he has saved other people's lives. His life has not been in vain. His son knows he is a hero. And she received a standing ovation. Some families from Wales have told us that deemed consent took the pressure off their decision. It made it easier. And they all remain proud. We continue to recognise the gift of donation and say thank you through the NHS Blood and Transplant Gold pins available to donor families. It's like the Pink Heart, but gold for donor families. And the Order of St John Award for Organ Donation was established in 2013 as a national and approved by Her Majesty the Queen posthumous award for the donor. Deemed consent is not a dry law. It has been personified by naming it Max and Kira's Law. Max Johnson received the heart from 9-year-old Kira Ball, who was tragically killed in a car accident. In the top right, you can see a picture of Kira's 2 sisters and brother listening to Kira's heart inside of Max. At the joint British Transplantation Society and NHS Blood and Transplant Congress in 2019, Max and his mother Emma spoke, alongside Joe and Loanna, Kira's parents. This shows Max at the podium speaking. He was amazing. And in the top left, you can see Joe and Loanna with Max. And the video I'm about to show begins with Kira's parents talking about her donation, and then moves on to Max and his family discussing the law change. And on this video, we will conclude this talk.
I saw there was a line of ambulances lined up, and one by one they came out with containers, and so I watched all of her organs leave, which was quite emotional. She obviously failed a brain dead test. The organ donation team did come in and just said, is it something that you would thought of in the past? I didn't feel pressured at any point. So I just looked at Kira and thought if Kira was given the option, I'm sure she would have said yes. Because it was in her nature, wasn't it?
Yeah.
Yes.
Because that's just how she is. Yes, give this to whoever, you know, she's just a kind child. It's tragic, it's heart-wrenching that we've lost Kira, but unfortunately there was nothing that could be done for Kira. But the fact that she's gone on and saved 4 other people is absolutely amazing.
I honestly was ready to die. I didn't think I'd make it. I hugged Mum and Dad thinking it's the last hug with my parents.
It just felt really cruel because that sparky, active little boy became completely constrained by a failing body.
This thing goes in right there.
They fitted a mechanical pump that goes in the heart and effectively whirs around, and it whirs the blood around your body. It kept Max relatively safe whilst he waited for a new heart. Our thoughts about the donor at the time was an overwhelming sense of deep gratitude that the word thank you didn't do justice to. They've thought of others at that really difficult moment.
You going to go first?
Yeah. First of all, we need to frame this. Dear Max, I hope you are feeling much better after your heart transplant and are enjoying being back home with your mum and dad. And more lives will be saved. With lots of love, Theresa May. I love it. I remember asking Mum and Dad, could it be Max and Kira's law? And I'm so happy that they've done it. She's not saved one life, she's saved 4 people's life. She is a hero. I want everyone to talk to each other. What decision will it be? Let your organs go to waste and just decay, or save a few people's lives?